Since the start of the pandemic, care homes say they've been crying out for more support and resources, and it's still needed.
I hear that there is this shield around care homes. We still are not able to say that we can see or feel that shield.
I think the issue with care homes...
In an interview with Sky News, the Justice Secretary admitted NHS patients had been the government's focus in testing for coronavirus.
And we did decide to focus upon the NHS. I think the issue with care homes is that we've got many thousands of different providers, different settings. There have been lots of examples of care homes that have mercifully stayed infection-free, but sadly far too many cases of infection and then death.
Les Latchman is the spokesman for 350 providers in Birmingham and says he's surprised to hear such an admission.
I think it's refreshing to hear them finally come out with what the strategy was. I think it's something that we've all felt and seen for ourselves, that care homes was a second thought in this pandemic, and denying that it wasn't the second thought, I think, was a bit laughable for us in the sector. So now that they've actually acknowledged the problem, what we would like to know is what they're going to do about it.
Care homes say the Justice Secretary's comment is significant.
Probably the first time that we've had an admission that there was a priority for the NHS. We knew that from the very start of the pandemic, and in fact part of our challenge was that the priority for the NHS led to things like the disruption of the PPE supplies for care homes.
Sky News first spoke to Cathy Gardner last week, revealing her anger over government policies put in place at the start of the outbreak, which allowed patients who've had coronavirus to be sent back to care homes without a test showing they're clear. Cathy's 88-year-old father, Michael, died in a care home in April.
The collateral damage is there to see, and the policies are there to see. I just keep going back to the dates of when these policies and guidelines were issued and what the government knew at the time. They can't pretend they didn't know the risk to care homes. They absolutely did know the risk.
At the daily briefing, NHS England defended testing policies.
I'm absolutely sure that my medical colleagues would not be discharging patients under any circumstances unless they were sure that their medical treatment in hospital was complete, they were fit for discharge and it was safe to discharge them.
In spite of the admission of one minister, many care homes say greater support is still needed if they're to keep vulnerable people in care homes safe. Lisa Holland, Sky News, Birmingham.